I have tons of them. But let me say this for people who are my colleagues or who are trainees in their medical education journey. Um, it's kind of the little things that are even more professionally satisfying. I think would be the term a lot of people would use. Um, but those things that make me feel like I'm fulfilling my vocation as a doctor, the thing that I kind of thought my life would look like once I became a doctor when I was a pre-med studying like, bio 101 sort of thing, where you don't have an idea really of what physicians do. And it's the fact that, in my main clinical practice activity, as the medical director of an opioid treatment program, we were focused on opiate addiction. And it has a very, observable, definable natural history, the disease opiate use disorder does. But also it has a somewhat predictable and common improvements or a set of improvements that you see in terms of the patient's health as people get into treatment. And I mean, this is very general, but it's these little things day by day that I've learned. It's helped me to counsel patients when they come in. And, if somebody comes to get treated for opiate addiction, they're there because if they don't take opioids, they're going to be sick. And, I'm sure I've heard people say, yeah, serves them right or some negative stuff like that. But uh, we don't say that to other people. Certainly, if you had a severe flu or COVID and had all the muscle aches and severe vomiting and diarrhea and inability to regulate your body temperature. I mean, it looks awful. And it looks way worse than, what the average person experiences during flu season if they get, influenza or another kind of common infectious disease that we've all, have some experience with. And so you're talking to them and, they seem hopeless. They feel hopeless. They say they're hopeless. They're full of shame. It takes a lot to be like, hey, I have a problem with heroin or fentanyl, because that is embarrassing for people. It doesn't need to be. It is, I think, in large part because of the failure of physicians and healthcare kind of people to be places where people can share whatever they want or need to with somebody without suffering negative judgment or shame. But talking to these patients, being like, look, just give me 2 weeks on this medication, and I promise you, you will start to see a light. Right? It's going to take potentially years to get your life back or to get your life to where you want it to be. But if you can give it 2 weeks, you will start to see hope. If you can give it a month, just keep showing up, then you probably will find that you feel a little bit better about yourself. Like, you don't feel as bad about your past choices because you're looking forward to who to your potential and who you could become. You probably will have a little bit more money, which is a very tangible, practical thing, super helpful if you've, lost everything because of the disease. And then, this just tends to be the little thing you see every day. And that's really what stands out to me. Like, honestly, my patients thank me all the time. And I mean, pregnant women who don't have addiction are often thankful too. I'm not saying like my patients who don't suffer from opiate problems aren't thankful, but the frequency with which people thank me or thank like our counselors at at my clinic, or the nurses, it does seem to be like way higher a percentage. And a lot of it is just because we're treating them with human dignity. So yeah, that's what stands out to me. It's the slow things they get back. I'm taking care of an outstanding warrant for, possession of a substance. Now I can, pay a fine that's been looming over my head because our justice system seems to be built on a preferential option for sticking it to the poor. And, people get their licenses back. People get their kids back if they've had like interruptions in, custody arrangements. They cut off relationships that are unhealthy and learn what healthy relationships are and get healthy ones. They get jobs, they go to school, they enroll in a class of something that just interests them, which is a huge win to find something that interests you when you can't think of anything else about than like not getting sick from a lack of opiates. So yeah, there are a lot of individual stories that are absolutely awesome and amazing, but it's kind of the day-to-day stuff that you get to see measurable improvement week by week, month by month, that I think stands out to me the most and is the most rewarding part of doing this sort of clinical work.